Hi everyone, my name is Sasha Iglesias and my research proposal is on the effect of propofol induction on dogs that have undergone long-term treatment for Cushing's disease. Basically, the background of this study is that in veterinary medicine in particular, procedures requiring sedation are usually necessary at some point in a dog's life. While a procedure that may seem routine to many people, some dogs with Cushing's disease or any kind of medical diagnosis oftentimes have a harder time going through these procedures. They may be at risk. Veterinarians and pet owners may actually even opt out of these procedures just because of the increased risk and the reaction that pets may have to the anesthesia during the sedation or during the surgery. Specifically, we will be looking at dogs with Cushing's disease and how propofol, or the sedative used in order to induce sedation in dogs, will affect dogs with Cushing's disease compared to dogs, a normally healthy dog, due to the fact that Cushing's disease typically affects organ function, such as the kidney and the liver, sometimes after a prolonged time of treatment. Basically, for the introduction, we discussed that propofol is the drug of choice for most sedative procedures. It's a non-barbiturate drug. It induces anesthesia. Oftentimes it is administered through IV or intramuscular and is used in combination with other drugs for cats and dogs and other small animals. Once the patient is induced with the use of the propofol, they are hooked up to monitors that measure their blood pressure, their respiration rate, their heart rate, and other kind of signs that would suggest that the dog has been sedated. Currently, most of the study on propofol induction is on dogs deemed healthy, not necessarily anything specific on dogs that suffer from Cushing's disease or any other kind of disease. However, there are studies that suggest that dogs that have been treated for Cushing's disease and currently are suffering from Cushing's disease, as it is something that is lifelong once diagnosed. There really is no cure. There is a treatment for it, but there's no cure. So there is studies that suggest that dogs that do have Cushing's disease oftentimes do have decreased organ function, just because, depending on the type of Cushing's disease, a gland on the kidney can be affected, as well as the medication that is also given, which usually is trilostane or Veterol, can have an effect on kidney function in dogs. So just a little background, in order to diagnose Cushing's disease, usually vets will administer a series of tests and urinalysis, blood work, things like that. There's an ACTH stem test or stimulation test that is performed, and this basically is going to evaluate the blood levels in the dog and see how the dog is responding in terms of its adrenal glands when they are injected with the ACTH hormone. They basically do a blood sample pre and post ACTH injection. This will determine whether or not the dog has Cushing's based on the levels. They also perform a low-dose dexamine suppression, or low-dose dex. This is a response to the hormone cortisol, and this will determine whether or not the dog has a normal production of this hormone in its body or not. Dogs with a high dosage on the medication do seem to have more increased damage to the organ function, as stated in some studies here. But there do need to be more studies done to determine whether or not this specific medication, or whether the diagnosis of Cushing's disease in dogs is causing this organ function, and whether or not that organ function decrease correlates to the effects that propofol would have on dogs that are being sedated. The main research objectives for the study include whether or not long-term damage to the organs, such as the kidneys, occurring in dogs with Cushing's disease or being treated for Cushing's disease will affect the efficacy of the propofol administration, and whether or not it takes higher or lower doses of this sedative in order to get the same or similar effects of sedation on healthy or dogs that are deemed healthy. This is significant not only to pet owners, because as pet owners, when one of our dogs or cats are undergoing surgery, we always want to be well informed, well educated, and really confident in the fact that, you know, our dogs are being taken care of, that they're not going to have any kind of risk or reaction during the surgery, that everything's going to go well. But it also is very important to veterinarians so that they can be properly educated, and therefore they can properly educate their clients to see what's the best alternative for their pet, whether or not a surgery may be necessary or worth it if their dog is not going to be necessarily safe during these procedures as a normally healthy dog would be. Basically, the way that this study would be conducted is that there would be a sample size of around 56 patients. We would do it around the 60 to 75 pound weight range. That way, you know, we're not getting very small dogs that may be more fragile or delicate to such procedures, or very large dogs that are difficult to manure and carry on and off of the table, and therefore go through the sedation process. Within this group of 56 patients, there would be 28 healthy dogs and 28 dogs that have been diagnosed and are currently being treated for Cushing's disease. I would wait about the 4-month mark for the dogs being treated for Cushing's disease, just because this specific type of diagnosis does take a few months to determine or to diagnose properly. The dogs must go through a series of blood work in order to get them at a stable dose that stabilizes their blood levels and their hormone production. The 28 healthy dogs would be selected through a series of vet exams and vet blood work, urinalysis, everything like that, to make sure that their blood levels are clear and that the vets are able to rule out any kind of pre-existing condition that might be a factor in this study. We want to prevent any kind of co-founding factors or anything like that. They'll be divided into 2 groups. They'll be started at the similar levels of propofol, one that would be administered for their specific weight, and then they would be hooked up to the Doppler monitors, and that would record their heart rate, their blood pressure, everything like that. There are certain levels that we would try to stay between, just as vets and vet techs administer. When they administer propofol during regular surgeries, they're always, you know, taking a look at the vitals, making sure that everything's okay. We're gonna observe physical changes, such as any possible eye movement or stiffness of the muscle, relaxation of the muscle, anything like that, to assume that the pet has been properly sedated. As far as broader implications, I would say this work is really important, like I said, not only to pet owners, but as well to those who are now going through vet school or have already graduated from vet school and are now actively practicing medicine as veterinarians. I think this would be beneficial to them. As I said, many times dogs will have to undergo anesthesia at one point in their life for some kind of procedure, whether it be a dental or a spay and neuter or any kind of foreign body surgery, anything like that. And it's important to know the risks before, you know, going through those surgeries. It's important for pet owners for them to be confident in the fact that their pet is not at any risk, whether their pet has Cushing's disease or has any other kind of diagnosis that can translate through the use of the findings in this study. And that's all. Thank you very much.